Welcome to the show. The Greater Accra Regional Security Council is preparing a strategy to enforce President Akufo-Addo's directive for mandatory wearing of face masks. As checked by JoyNews reveals, some people have ditched the wearing of the masks. Others failed to wear it properly as mandated by health officials. Now, the few observing the face mask protocols are also worried and are demanding city authorities ramp up enforcement. Listen.
And if it's on, when I shout, they don't hear the A1 properly. That's why I put it down for me to shout for them to hear A1.
And when I'm trying to call a customer on the roadside, if the mask is on, the customer cannot hear him, so I push it down to call the customer. After that, then I put it on.
Because sometimes when I wear it, I don't feel comfortable. Yeah, like when I'm wearing it, as if I'm sweating, like I feel a sort of sweat on me, yes. I find it difficult in breathing so much because sometimes it tightens your nose. So at least 30 minutes time, you have to remove it so that you can breathe a little. Yeah.
If you have fever now, they'll say you have corona. No, mistakenly you first see they say it's corona. People are dying of hunger and they'll say it's corona. Let's just be realistic. Let's say the truth. Let me tell you the truth. I don't believe there's COVID-19 here. Because actually, most patients, they show us that the numbers they keep telling us that we have COVID-19, both in Nigeria and here in Ghana. None of my friends or my family could ever testify that, oh, this one person is a friend that has COVID-19. I've not seen it being real.
So until you see it, before you believe?
Yes. We Africans will believe in seeing before we believe. Those there in Europe, we saw them and we saw their patients. Why can't Africa just show us a single patient of us?
When the case started, everybody was following the steps and we're all putting on the necessary steps. Let's say nose masks and other things. But it got to a time, the general public, all of us, we lose so relaxed. And I think the law enforcers, they have to up the game because looking at things, the figures are going up.
So those are mixed reactions, those wearing it, those not wearing it, those who don't even believe in the existence of coronavirus. In his address last night, President Akufo-Addo warned that persons who fail to wear face masks in public would be in violation of the new executive instrument and face possible prosecution.
It is important for me to remind residents of the Greater Accra and Ashanti regions, where the great majority of cases have been recorded, and in the western and central regions, where we're seeing an increase in infection cases, to continue to adhere strictly to the social distancing and enhanced hygiene protocols announced. With the doctors and scientists telling us that the virus is transmitted from human contact through talking, singing, coughing, and sneezing, which results in sending droplets of the virus from one person to another. Residents of these 4 regions, and indeed all Ghanaians, must remember that the wearing of masks is now mandatory. Leaving our homes without a face mask or face covering on is an offence. The police have been instructed to enforce this directive, which is the subject of an executive instrument. Let me repeat, our survival is in our own hands. If we are lax and inattentive, we will continue to have serious challenges with the virus. If we are mindful and self-disciplined, we have it in us to defeat this pandemic and help return our lives to normalcy. I appeal to each and every one of you for your help in this regard.
So that's President Akufo-Addo last night in his address. We'll be having 2 different conversations on this particular issue, one from a medical perspective and the other from a legal perspective as far as the enforcement of the wearing of face mask directive is concerned. First though, let's take a look at the case count, just to refresh your memory. So the total confirmed cases is 11,964. It doesn't mean that 11,964 people are living currently with it. You have to take away the recoveries and deaths. And so if you do that, 7,652 is the number of confirmed cases. 4,258 have recovered, but 54 people have died. 54 people have died. All right, so let's have this conversation. I'm connecting with Dr. Benedict Baah. He is an epidemiologist and senior lecturer at the University of Ghana Medical School. Doc, thank you very much for your time this afternoon.
Thank you very much for having me, and good afternoon to your viewers.
Very well. I just want to get what your thoughts are looking at the numbers so far.
Well, as we can all see, the numbers are increasing, and what it tells us is that the virus is with us in our communities. It is being transmitted within the communities, and therefore I say that the frontline staff are no longer the health workers, but we, the citizens of Ghana. Each and every one of us has a responsibility to protect himself or herself by adhering to the numerous measures that have been clearly outlined. So those would be my initial comments.
There's community transmission. I mean, the community transmission has been with us for some time. At the point where it wasn't was when we feared, when the borders were even still open. Now we know it's come to stay. When you say everybody ought to take steps to consider themselves as frontline workers, exactly what can we do, especially when this is a virus you can't see with your eyes?
That's very true. You can't see the virus with your eyes, but there are recognized, proven methods that have so far been working. And that includes the hand hygiene, washing under running water and soap, using the hand sanitizers when water is not readily available, and the wearing of the face mask. Now, the reason why the face mask is so important is because when you look at the data we have in Ghana, over 90% are asymptomatic. In other words, they are not exhibiting any of the signs or symptoms we know, no fever, no cough, nothing. So they are just moving through the community. And it has been proven scientifically that people who are not symptomatic still have the capacity to transmit the virus. So if each and every person is putting on their mask, then what is going to happen is that whatever virus I may be carrying, I limit it to myself. Whatever virus the other person is carrying is limited to that other person. And since the virus does not have legs on its own, but it moves as people interact, if we are protecting each other this way, then we reduce greatly the probability of this virus moving from one person to the other. Already, we have indications that our health facilities are beginning to get overwhelmed.
Yeah.
And therefore, if we want to win this war, it is good to have policy directives, but it is more important enforcing these policy directives.
So enforcement is one of the biggest problems that this country has. And you don't really need an angel to tell you that. We've seen that run through all of the problems, the major problems that we have. Enforcement. But I'll come to enforcement. I want you to take a look at how you reconcile the numbers with the push for normalcy. I mean, before the restrictions were eased, people wanted to go to church. Some people said they wanted to go back to school. Now that has been granted to some extent. How do you reconcile the numbers, the spike in numbers, vis-a-vis a request, or if you like, a push by some to get back to normalcy by going to school and going to church?
Right. Much as I agree that we should try to get back to as normal as possible, I was personally disappointed in how this whole thing was carried out. When there are restrictions and you ease the restrictions, the general impression it creates is that things are getting better or things are okay. I would have expected an intensified, commensurate public education with the easing of the restrictions. I didn't see that happening. Maybe others felt it. But in my own community, I haven't had any education whatsoever. What I would have expected was an intensified education to let people know that these sanctions are being eased, not because we are out of the woods, but because life must go on.
Right.
And I would have expected to see the information services van going through our communities, announcing in the local languages that every Ghanaian can understand. You know what? When it is time for campaigning for elections, we are able to go to every nook and cranny of this country. It doesn't matter how remote they are. We get there with the information that so and so wants to be voted for. Why can't we adopt the same measures in spreading the news about coronavirus? I don't think we have done enough by way of public education. We haven't exhausted all the avenues available to us. I don't know how much our traditional leaders have been involved in this, because we have traditional leaders who have so much power, they have so much authority. When they speak, their subjects listen. Have we engaged them in this? I don't know to what extent. But I don't think from where I sit, there has been enough education. The other aspect of enforcement is not just getting the security agencies to chase people around. I think leadership should be by example. And I have been personally appalled at some of our leaders coming on national TV, sitting in parliament, having their mask on their chin. That doesn't set a good example. Personally, I've had my own frustrations trying to educate the populace. And then they will give you a reference to a certain leader who is not doing it right and yet insisting that people do it right. Leadership, first and foremost, must be by example before you can expect others to follow. And in that regard, I don't think we have done very well.
I'm happy that you touched on enforcement, so we don't even have to go back to it. But the Regional Security Council, we understand, is working on some sort of strategy to help with that enforcement. You think that it should come from leadership, but when it comes to getting the job done on the ground, not just on working on the psyche of people, you need people to do that. Isn't that a way to go as well?
Well, it works both ways. You see, I gave that example because personally I have had that frustration. You try to talk to people who are either not wearing their mask or not wearing it right, and then they point to leaders who are doing as they are doing and use that as a justification. And so it should start from the top. But having said that, it should also be enforced and ensure that every Ghanaian would wear their mask as long as they are in public space.
In terms of case management, what would be your recommendation? You've indicated that now is up to all of us. Now it's become our job, not just the frontline health workers. But we know that we don't have enough health facilities in this country. We know that even the normal healthcare delivery, we've had major concerns with it. Throw coronavirus in there and you have a major situation. What do you recommend in terms of case management?
And that is why this health education is so important. Because you see, when the cases rise, we don't have the capacity to manage them. We don't have enough capacity to manage severe cases. We don't have enough ventilators to go around everybody. So our best bet is to educate the people. This disease has been with us for almost 6 months and 3 months in Ghana to be precise. And yet there are people who still don't believe it exists. That's an indictment on our public education. If after 3 months, people have still not heard, then it's an indictment on us, and we need to up our game. I think we have relaxed. We started very well. We started very well, but I think now we have relaxed, and if we are not careful, we may lose this fight.
I hope against all hopes that we don't lose this fight. But I have been under the impression.
Just a point.
Please go ahead.
We have history to guide us. If we look back at what happened during the Spanish flu in the early 1918 to 1920, it was a similar trend. It was a virus that was novel at the time. It was a virus that had no cure. It was a virus for which there was no known vaccine. Now, all the measures we are implementing today were implemented then. That pandemic occurred in 3 or 4 waves, depending on which literature you are reading. And the second wave was the most disastrous. And that occurred after the sanctions or the impositions on restrictions were lifted. People went back to business as usual because they were now free to do all the things they were not able to do during the restrictions. And it's beginning to happen. You just need to drive through town. I mean, 2 days ago, I was at the spare parts lane in Abosukain, and it was just terrible. Drive through Jamestown, drive through Kolegono, drive through any parts of Accra. And it's happening because people have gone back and they think it's business as usual because the restrictions have been eased. And it didn't go with a commensurate education to let people know that we are not out of the woods yet.
So restrictions have been eased without the commensurate education. I have been under the impression that perhaps if we start highlighting the deaths, we start highlighting, you know, for example, put a human face to the figures, that will help solve the problem. Is that an opinion you share?
You know, for people to really appreciate what is happening, yes, it will be good to put a face to the numbers. You know, when you say 54 people have lost their lives, it looks like just numbers.
Yeah.
But if we can put faces to these numbers, if people who have tested positive would be willing to share their experiences, as some people have already done, you know, it's patient confidentiality. So every person has a right to decide whether they want the world to know their status or not. We can't force anybody. But if people who have had exposure would be willing to talk about it, I know the media is doing its part by visiting some of our treatment centers and letting people know. But then that alone is not enough. We need to let people understand the severity. If it's possible to show some of these graphics without revealing the identities of the people involved, then I think it will work on the psyche of people, and people will begin to appreciate the reality of this. You know, sometimes when we throw around these figures, they are all statistics. If it happens to you, it's no longer a statistics, it's 100%. And that is something we shouldn't lose sight of.
My final question, you are a lecturer at the university. Today, the universities have been open for people to go back to school. The concern has been that, look, we're trying to get back to a semblance of normalcy, but we're really not there yet. People have said, this has come to stay. Whether you like it or not, it won't go away. So you better get on with your life or waste your time losing whatever little gains you have made over the years. Where do you stand on this?
Well, like I started saying, I agree life must go on, but we need to tread cautiously. We also need to learn from the examples and mistakes of other people. There are countries that opened up their schools, opened up churches, and there were repercussions. Yes, the government has given a directive, and as a school, we are preparing to receive our students. But I'm part of the committee that was tasked by the Dean of the Medical School to put together guidelines to ensure that there is minimum transmission amongst our students. So we are taking all the necessary precautions. But let's bear in mind that these measures do not eliminate completely the risk. They minimize them. And therefore, we all need to be extra vigilant. The responsibility lies with each and every one of us. If you can appreciate the fact that associating with somebody who is not in a mask puts you at risk, and so avoid them. If we all do that, very soon everybody will be masked. And there are those who would give excuses about the mask. I don't have a mask, I don't have a fitting one. You see, we can always improvise. If you don't have a mask, half a loaf is better than no bread at all. You can even start with your handkerchief. It may not be as effective as a surgical mask or an N95, but it's better than nothing.
Okay.
And then we should always make it a habit to wash our hands with soap and running water, because as we move along, the virus settles on surfaces, and we may pick things inadvertently without realizing. So those are some of the things, and as much as possible, let's maintain the physical distancing.
Right.
When you drive through town, it doesn't give you that impression. Sometimes it really scares me.
I can certainly relate to that. Well, that's it. If you have any final words, Doc, I'd love for you to add to this, especially for our case management, our facilities, etc. I believe that that's where perhaps the focus will be pretty soon.
Well, in the short term, there is very little we can do about expanding our facilities. I know there are plans to put up more facilities, but in the short term, our best bet would be to observe all the safety precautions that we are being encouraged to. And let us remember that you are not doing the government a favor, you are not doing the health workers a favor by observing these rules. You are protecting yourself, you are protecting your family. And so I would urge each and every one to abide by these rules, especially the face masking. And I would say not only in the regions that are reporting the high cases, but throughout the entire country. And if we do that religiously, I believe with time, we will win the war against this virus.
Doc, thank you so much for your time this afternoon. I've been talking to Dr. Benedict Baah. He's an epidemiologist in University of Ghana Medical School, helping us with his thoughts there. I hope wherever you are and whatever situation you're in, you're at least wearing your face mask. So President Akufo-Addo has been defending his government's handling of the pandemic during his last address last night as well. Let me refresh your memory with that bit.
Operating with half the class size, final year students will begin a 6-week period of learning to finish their respective programs. Subsequently, for a period of 4 weeks, they will sit for their exit examinations. It must be put on record that some final year students will not be returning to school, as some of them, through virtual means, have already sat their exit examinations. Prior to their return to school, government, through the Ministry of Education and the Ghana Education Service, has ensured that all tertiary institutions, public and private, have been disinfected. Universities, with their own hospitals and clinics, have been equipped with the necessary personal protective equipment and have isolation centers to deal with any positive cases. All other institutions, without their own clinics and hospitals, have been mapped to health facilities. There will be no mass gatherings and no sporting activities. Religious activities under the new protocols will be permitted. Social distancing and the wearing of face masks must become the norm on campus. To aid in this effort, a total of 600,000 face masks has been distributed to the tertiary institutions. This is to enable every student, teaching and non-teaching staff, to have 3 reusable face masks. In addition to this, 1,700 Veronica buckets, 200,000 liters of hand sanitizers, 3,400 liters of liquid soap, and 900 thermometer guns have been distributed, with the transportation and delivery of these items being overseen by the Special Logistics Team of the Government Committee, chaired by the sagacious, experienced politician, the Senior Minister, Honorable Yao Safo-Mafo, that is supervising the reopening of the schools. I met with the Vice Chancellors of the universities, both public and private, last Tuesday, who pledged that they would cooperate to ensure that this exercise is effectively undertaken. And I thank them very much for their cooperation.
President Akufo-Addo there, unfortunately we didn't bring you the part where he is defending how his government has managed the situation, but he's talking about the reopening of schools. I'll be having a conversation about what it means legally when he says mandatory wearing of face masks. I'll be joined by Akufo-Addo. He's a state attorney. When we return from this break, I want to hear from you. Do send us your thoughts on our WhatsApp platform. I'll be right back. Welcome back to the show. Like I said, I'll be joined in this discussion by Akufo-Addo. He's a state attorney at the Office of the Attorney General and Ministry of Justice. He's in the Volta region. Sir, thank you very much for your time this afternoon.
Thank you for having me, and good afternoon to your listeners.
Amazing. So when the president says mandatory wearing of face masks, we've heard that before. On the face of it, it looks like you have to wear it. But what does it legally mean?
Well, if the president says wearing a face mask is mandatory, then there's no legal backing. However, I heard the president expressly say that if you do not wear the face mask, it is an offense, and it is a subject of an executive instrument to be issued. So now, wearing a face mask is no more something that you can just go without, then they would just use administrative efforts to compel you. Now, it is an offense. It is a criminal offense, and it's going to be a subject of writing in an executive instrument. And I wish to draw our attention that a mere declaration does not make something an offense. Under Article 1911 of our 1992 Constitution, it says no person shall be convicted of a criminal offense unless the offense is defined and the penalty for it is prescribed in a written law. So for this to become an offense, it must be put in law, and in this case is the executive instrument, because the Imposition of Restriction Act gives the president the power to impose certain restrictions. And if you do not comply with the said restrictions, there are sanctions to be applied. And in this particular case, and I believe very soon the EI will be out. The EI will spell out exactly what, if you do not do, would constitute an offense. And in this case, the president has said wearing of nose mask or nose covering or face covering. So not only limited to nose mask, but something that can cover your nose or cover your face to prevent you from infecting others or from others infecting you. So I see that pretty soon we are going to have an EI spelling out specifically what the offense is and probably the penalty that you face if you fail to wear a face mask.
So it's more like something that's yet to be issued, an EI that's yet to be issued, even though the president mentions it. Between the time that he mentions it and the time that the EI is actually issued, does it still make it an offense not to wear one? Can people just go around and not? Can someone be arrested and charged for not wearing masks within the period that the EI is not ready?
So, just as I mentioned, nothing is a crime unless it is stated in the law.
Okay.
So, a declaration by the president when there has not been in a written law and gazetted, my understanding of the law is that that will not constitute an offense, because if you are being prosecuted for an offense, at the time you are doing the act or at the time you omit to do a particular act, that should constitute an offense. I cannot be punished for any offense that at the time you were committing the offense, it was not stated in any written law or it had not become an offense. So my understanding, and this has been what we have been seeing so far, usually the executive instrument would almost
Okay, well, it looks like the line is freezing on us, but we're still, trying to get that through. You do know that some of these things happen. I'm talking to Akufo-Addo. He's a state attorney at the Office of the Attorney General and Ministry of Justice in the Volta region, to be specific. And essentially the point he makes is that it is a criminal offense if it is detailed in an executive instrument and you do not obey it. So wearing of masks is an offense. That is, and he's explaining this to us further, if the EI backing it comes out, and then it becomes an offense. So what I'm trying to get him to break down, because I don't know, as of now, there is no EI backing this, at least to the best of my knowledge. So what I'm trying to get through is whether or not between now and when the EI is ready, I can't be arrested, prosecuted for not wearing a face mask. And that's what he's been trying to break down. Are you still there, Andrews? Okay. Well, I'm not, we don't have him yet. We'll come back to this particular discussion and I'll get to read some of your messages that you're sending in. But we're back. Okay, I do have him back. Andrew, you were explaining to me how it works within the time that the EI, the executive instrument, is not ready when a declaration has been made. How it works. Please go ahead.
So my point is that the Constitution, the law must be a written law, and so on to an extent that there's an executive instrument. In my mind and in my understanding, per the requirement of the law, you have to wait to see the executive instrument, because the executive instrument will spell out what the offense is and the punishment that is to be given. So our advice that to follow the procedure, we must stick to the dictates of the Constitution, which we are all guided by.